Senior Moments, sponsored by the Empowering Seniors Group on News Talk KVNU, 102 FM and 610 AM.
Good morning, everyone. Welcome to the Senior Moments Show. My name is Bryce Patton with my co-host Sid Roeder. How are you, Sid?
I am doing fabulously. How about you?
Fabulously? That's
fabulously
wonderful. You know, I'm good. My kids slept through the night last night, so I'm a happy camper.
Awesome.
You know? Well, excellent. We have a wonderful guest again today. Before we dive into that, do you want to introduce our sponsor for the show?
Absolutely. I'd love to introduce our sponsor, which our guest is a member of, which is the Empowering Seniors Group. A group of professionals that has dedicated their time and efforts to provide information to seniors, their family members, and anyone that cares. If you'd like to learn more about the Empowering Seniors Group, you can do so online at empoweringseniors.info, or you can email us at empoweringseniorscv@gmail.com, and the CV stands for Cache Valley. And lastly, if you have any suggestions for this show, anyone you would like to see us invite, you can call me personally at 435-512-6406.
Excellent. Thanks for doing that. I'm glad you love it. All right, let's get into our guests. We have Tracy Ferris with Bluewater Health Insurance with us today. Tracy, you want to welcome to the show, first of all.
Well, thanks, Bryce.
I'm really glad you're here.
I'm glad to be here.
Are you sure?
I'm
okay.
positive.
Good. Well, do you want to tell us a little bit give us a little background on you besides that you like pearls and going to sandy beaches?
Well, in addition to that, I've been in business for 13 years. I love what I do. I love making sense out of something that is very difficult to navigate on your own. And it's just it's a very rewarding field, and I love what I do.
That's excellent.
Yeah, you're a Medicare expert.
Yes.
And I know every time we do have you as a guest, I know I do learn or remember something that I forgot again. So maybe you want to start out with some of the basics for us, Tracy.
Yeah, well, excuse me, when a person is turning 65, they become inundated with mailers galore and phone calls from, solicitors and all kinds of things that happen. And it just becomes really information overload. So to use a person like me that's an agent that's licensed with all the companies that are available here in the Valley, it just really uncomplicates things. So when we are starting to, sit down and talk to a person, the first thing that we're going to ask is, what their needs are, and we're going to go through the basics. The basics would be Medicare Part A and Part B. Well, Part A covers hospitals, Part B covers doctors, and then, of course, they would need a drug plan on top of that. So, that's an option for them, but then on top of that, there's also things like Medicare Advantage plans or Medicare supplements. So there's a whole lot to navigate when we get into that conversation.
That's fantastic. Now, when they get inundated with all those things, and there's so many things that go into Medicaid Part A, B, and whatnot, and there's supplemental plans, right? Do you do
Correct.
Supplemental plans?
Yep.
Okay.
Yes.
So how do you like to present this? Do you like to sit down with the family, or do you like to do it over the phone? Is there a better way to do it for you?
So in person is always best. I'm a visual learner myself, so I do like to, sit down with people. I think it makes more sense if they can see it visually and hear what I'm saying at the same time. In person is preferable. Doesn't mean it can't be done over the phone.
Now, does that cost anything for people to sit down with you and explore plans?
It does not. Nope. I am paid by the insurance company, so that's further down the road after we've made a decision as to what they, would like to enroll in and, if we've explored everything and made sure that we've covered doctors, hospitals, networks, medications. There's just a whole list of things that we would explore before we ever chose a plan. And then once that plan is chosen, then I am paid that way.
So there is a specific time frame that people have to come and figure that out, correct?
Yes. Yep. So we can actually enroll into original Medicare, which is the Part A and Part B. We can do that 3 months prior to their birth month. So if their birthday was July 15th, we could back up 3 months from July and start that process. Then once their Medicare card comes in the mail, that's their red, white, and blue card, then we can sit down and start having those more in-depth conversations about, Plan A or a supplement or a Medicare Advantage plan or whatever it is that they want.
Now, when you sit down and you start it, now I'm not quite 65 yet, but when you're going over that, is it kind of set in stone once you start off right off the bat?
Well, the federal government obviously has a very deep hand in Medicare. And so as far as coverage goes, yes, it is strictly highly regulated by the federal government. So, for example, a supplement plan like Plan G, which is, the most popular plan right now, if a person was to choose that, it is the same coverage no matter what private insurance company you chose to use because the federal government regulates that.
Oh, interesting.
So what are some of the things that people need to bring when they sit down with you? What do you need to see?
Yeah, so what we want to take a look at is, some of the plans, like a Medicare Advantage plan, they have a network that we must adhere to. So if that was going to be their choice, we would want to look at their doctor preferences, their hospital preferences, and then, of course, always, no matter what, we'd always want to look at their medications. If they're looking more at a Medicare supplement, it does not have a network restriction with it. So doctors' hospitals wouldn't be as much, of an issue, but for sure we would still want to look at their medications.
Oh.
So do you always also, before we come up on our first break, do you also look at family history if somebody comes in and still is pretty healthy at 65? Do you advise them, for example, if they have certain health conditions in the family to maybe take certain supplements?
I try really hard not to give advice, just information. I know everybody wants me to tell them what they should do, but I try really hard not to do that because it is such an individual decision. However, with that being said, certainly there are factors that we would want to take into account. Family history could be one of them, or their current health conditions at that point. So yes, that is certainly a conversation that would be worthwhile.
Okay. We're already coming up on our first break, Tracy, but I want to give you a chance to mention your phone number and location if anyone's interested in contacting you.
Yeah, so again, it's Bluewater Health Insurance. I'm at 74 West, 100 North in Logan, and our phone number is 435-294-2161.
Thank you, Tracy. We're going to take a short break. This is the Senior Moments Show. Stay tuned. We'll be right back.
Did you know 1 in 3 people will visit a nursing home? Did you know that once there, they will stay there for an average of 3 years? Did you also know there are insurance options that can help cover this experience? Hi, I'm Tracy Ferris with Bluewater Health Insurance. It's not cheap to stay in a full-fledged nursing home. Long-term care insurance can help you or a loved one get the care they need and deserve. If you wait until you need it, you may be too late. Give me a call at 435-890-8155.
At Maple Springs Senior Living in North Logan, we understand that entrusting the care of your loved one to someone else is a decision not taken lightly. That's why we go above and beyond to create a nurturing environment where your family becomes our family.
When I found Maple Springs, it was like a weight lifted off my shoulders. The staff here really cares, and Mom is thriving.
The activities and social events have brought so much joy to Dad's life. I can see a positive change every time I visit.
We know that your loved one's well-being is your top priority, and it's ours too. Learn more at maplesprings.living.com.
You have a lot of options when it comes to buying or selling a home. Do you list it online, sell it yourself, or do you have a realtor help? It's a major financial and emotional decision. A realtor is the liaison between buyers and sellers and really helps you navigate complex contracts, deadlines, and disclosures.
Hi, this is Sid Roeder with Achievement Realty. I work for you to get the best outcome for your situation. Let me earn your trust with a free consultation and a free market analysis. Call me today at 512-6406. Then list it, sell it, and move on.
And welcome back to the Senior Moment Show. My name is Bryce Patton, with Sid Roeder, my co-host, and we are sitting here with Tracy Ferris from Bluewater Health Insurance, and she's been telling us all about Medicare and how wonderful that is. We were talking about everyone's fear of retiring. Do you want to dive in on that? And how that insurance affects retirement and all that fun stuff.
Yeah, so if I could, summarize the two biggest phone calls that I get, the first one is, I'm still working, I'm going to be 65, but I plan to continue to work. Do I need to take Medicare? Well, the answer to that is no. If you are employed by a company that offers insurance, you do not have to take Medicare at age 65. The caveat to that, of course, is once you quit working, even if they were like to pay out a severance package that prolonged your health insurance for another 6 months or whatever, that is not an event that would get you out of the penalty of Part B. So at the point that you quit working, that is when you would need to transition to Medicare. So that's the first question I get. The second question that I get is, hey, I want to retire, but I carry the insurance on our family. Neither one of us are quite 65, but we just can't afford the premiums. So what do we do? And I love to have that conversation because a lot of people just don't realize that there are a multitude of options out there for things that we can do that makes health insurance very, very affordable. The first one is, Obamacare, that everybody either loves or hates or is somewhere on the scale in between. But, that's where the federal government pays a portion of the premium based off of income. And let's face it, when people get ready to retire, the saying is twice as much time, half as much money. So, if that's the situation, you're probably in a great position to get some kind of subsidy to help offset the costs of your monthly premium on health insurance.
So do you have a lot of people that come in and have that conversation with you besides talking about Medicare?
Yeah, I would say probably at least 3 or 4 times a week minimum that I'm having that conversation with people. Because what we see a lot of is, the husband is ready to retire. He's 66, but his wife is only 62. What do we do with her until she is 65? Obviously, he can move to Medicare. That's a no-brainer. But if he's carrying the health insurance, what do they do for her? Well, it's usually a very easy solution. But, people just don't know what their options are. And so it becomes a really scary scenario for them. And they just kind of put it in the back of their mind and think, I just can't retire because my wife isn't 65 yet. When in reality, that's just not true.
So I've got one follow-up question there, because usually we have certain times that we can sign up for health insurance. So if the husband retires, does that allow for the wife to immediately get insured with you with the health insurance, or do they have to wait until that window opens up again?
So that's a really great question, and the answer to that is that we can do it immediately. And the reason is because it's called a special enrollment period. So they have a qualifying event, and that qualifying event is the loss of coverage through their job. So we are in a position where we can put them onto a plan that would start immediately the month following the loss of coverage. So they wouldn't have a gap in coverage. They would be great and fine as long as they were contacting me, at least in the month that they're going to lose the insurance. So easy.
That's fantastic. So I was kind of held up on this when you said outside the penalty. Like, how do you get penalized with the insurance?
Yeah, so with Medicare, there are two places where you can be penalized. You can be penalized for Part B as in boy and Part D as in dog. The federal government says, hey, we want our money from you, because Part B has a premium with it. We want our money from you, and we want that money starting at 65. And the only way that we're not going to take that money from you is if you have other insurance through a job. But other than that, we want our money. And so what they will do is if you wait for, a year or 2 years or whatever, there's a 10% penalty per year for not signing up for Part B when you were eligible, and a 1% penalty for Part D. So obviously Part D is much less of a penalty, but Part B, can be significant because it's 10% of the premium for Part B, which this year the premium for Part B is $174.70 a month. So you'd be looking at, $17 a month for the rest of your life.
Oh, wow. And so what is the range again that you have to enroll when you turn 65? You get 3 months prior, but what about after?
Yeah, so you get 3 months before your birthday that we can enroll you. The plan wouldn't start until the month of your birthday. But, okay, so 3 months prior to the month of and 3 months after. So it's a 7-month window that you have to enroll into Medicare and choose a plan without having any penalty.
Okay, so I have
Yeah. Go ahead.
So what if somebody is planning on retiring and going on a mission and they might be out of the state or something? I know that happens quite a bit here in Utah. Can they get things set up with you prior so that you can enter it in while they're gone?
Yeah, so that's actually a really good question and something that we actually have not talked about on this show ever. So we deal with this a ton here in Cache Valley for sure. When people get their mission call, what we decide to do with Medicare is hugely dependent on where they go. If they are leaving the country, I always advise them to disenroll from Part B and go onto their church's insurance. There's no penalty for doing that because the church provides documentation when they come back into the country to re-enroll into Medicare and show that they had coverage for those, 18 months or however long they were gone. So that's how we would handle out of the country. If they were staying in the country, a lot of times we may have to switch their plan or at least their drug plan based off of location as to where they'll be serving. But yes, to answer your question, we can get that set up before they leave if we're in that window.
Wow. It sounds like good advice is necessary in those instances. And that brings me, before we go into our next break, brings me to the point of getting your contact information one more time.
Yeah. So we are at 74 West, 100 North in Logan. And our phone number is 435-294-2161.
Thank you, Tracy. Learning so much about Medicare and all things health insurance. Again, this is the Senior Moment Show. We are sponsored by the Empowering Seniors Group. If you'd like to learn more about the Empowering Seniors, you can do so online at empoweringseniors.info. We're going to take a short break. Stay tuned.
Did you know 10,000 baby boomers qualify for Medicare every day? Did you know that you'll start to get swamped with mail about Medicare 6 months before your 65th birthday? Did you also know it doesn't cost anything to use an insurance agent to help you navigate through all those offers? Hi, I'm Tracy Ferris with Bluewater Health Insurance. Let me help you understand all the offers you're receiving and find the plan that fits best for your situation. Call me today at 435-890-8155.
This is Mark Thurston with White Pine Funeral Services. The best time to plan is when you have time to plan. Having a prearranged funeral gives peace of mind for everyone involved. White Pine will customize your final wishes to fit your needs, from a traditional burial to cremation to a custom headstone. White Pine also accepts prearranged plans from other mortuaries, and we will absorb any transfer or revocation fees. No penalty to you. Visit whitepinefunerals.com or come and see us for more information.
White Pine Funeral Services, here when you need us most.
Hi, this is Bruce with Comfort Care. One of the ways we help loved ones stay in their home is by assisting with daily tasks. These may include bathing, meal preparation, medication reminders, and housekeeping. We even help with shopping, transportation, and errands. Most of all, we offer a trusted level of care. Let us help you live your best life possible with Comfort Care. This is Bruce, and you can call me at 754-7676. Comfort Care, 754-7676.
Reed's Pharmacy in Hiram offers free delivery service 5 days a week, Monday through Friday throughout the valley. Just stay home and they will deliver to you. With 25 different suppliers, they won't have the shortage that others might have. Also, with compounding and many other services, they will be able to serve all your needs. In order to stay safe and help slow the spread, please call Reed's Pharmacy in Hiram at 245-DRUG and they will take care of you.
And welcome back to the Senior Moment Show. My name is Bryce Patton, here with Sid Roeder, and we have been learning all about Medicare from Tracy at Bluewater Health Insurance. Now, Tracy, I had a question. Now, you know, I'm in that point where I'm trying to plan for the future and trying to figure out how much I need to retire and, you know, make a game plan for hopefully a few years in the future. But does the amount of assets and money that you have saved up, does that affect any part of your insurance going forward with this?
So that's a great question, and the answer to that is no, not in retirement accounts. However, the Part B premium that I mentioned earlier is $174.70 per month. That is based off of income. So if a couple is married, that threshold of income is about $200,000, and that is AGI, so your adjusted gross income, $200,000 or less. And that's not exact, but very close. So as long as their adjusted gross income is below that threshold as a married couple, and it would be half of that for a single, then that premium will be $174.70 per month. However, if it is above that, they will pay an increased amount for Part B. And the way that is determined is the federal government every year that you're on Medicare is going to look back 2 years to your taxes and see what your AGI was for that year. So we're in 2024. So let's say in 2022, I made $500,000. This year, my Medicare premium for Part B would be around $500 a month.
So it does have a big effect on it.
It does.
Okay.
Yeah, and let's talk. During the break, I had a fun question for you, and maybe I want to put that on the air. It was like we've talked about the mission and coverage there and halting things. The question I had is if somebody decides to maybe for the winter months to move out of country to Mexico or somewhere else, how does that work?
Yeah, so I mean, as long as they're not out of the country longer than 6 months, or even outside of the zip code, depending on what plan they're choosing, because Medicare Advantage plans are based off of your zip code. So as long as they are not outside of that for longer than 6 months, they're fine. They can stay with what they have. You know, they'll still have urgent and emergent coverage if they have a Medicare Advantage plan. If they have a Medicare supplement plan, it's going to be covered just fine. If they were to leave the country, that's a completely different ballgame.
So, follow up there. If somebody does leave the country, can they halt it? And if they were to re-enter, reinstate that? Or do you know, are there any penalties attached to that?
They can halt it, but they would have to prove that they had credible coverage in the other country in order to avoid paying the penalty.
Wow, interesting. I guess I'm staying in the U.S.
Well, there's tons of fun places to travel. I mean, with what it sounds like, you could travel the U.S. for 6 months, come back home, you'd be fine.
Yeah, for sure. And, you know, if people want to, you know, go to Mexico for 3 months, and I mean, they'll be fine. That's totally fine. They can do that. They're, like I said, depending on coverage, you know, it's maybe urgent and emergent. But one thing that everybody has to remember is when you go outside of our country, other countries do not deal with our health insurance system. So you're paying the bills up front, and you're getting everything possible on documentation for what you paid, what was done procedure-wise, and you're bringing it back into the country and submitting it to your insurance company for reimbursement.
That brings up a great point. I hadn't even thought about that. So you can get reimbursed for when you go out of the country then?
You sometimes can. I'm not going to say 100% on that because every insurance company has a little bit different rules on it. But as a general statement, that is the way that it would have to be handled. And then, of course, it's up to the insurance company whether or not they're going to reimburse claims.
Have you ever, once someone gets their health care and they have questions, you've signed them up, can they come to you back with questions or anything?
For sure, and I hope that they do. If there is a problem, my preference is to get involved right off the bat because then I can follow what is happening and not be trying to play catch up in the middle of it. So yeah, that's why they have me, not just to sign them up and then say, I hope I never see you again. No, it's you have me, I'm a resource. If you have a question, if there's problems, that's why you have an agent.
Now, have you helped someone through this when they needed help after?
100%, yes, daily. That is what I do outside of open enrollment.
That's great, Tracy. Yeah, I know from my own experience you've helped my family in your capacity there with Medicare, and it's been great. Sadly, we're coming up on the end of our show here, so I want to make sure that you have another opportunity to share your contact information.
Yes, thank you, and I appreciate being here. So it's Bluewater Health Insurance. We're at 74 West, 100 North. And my phone number is 435-294-2161.
Thank you, Tracy, and thank you for coming in and educating us. This is the Senior Moments Show. I want to mention our sponsor, the Empowering Senior Group. If you'd like to learn more about them, you can do so at empoweringseniors.info online. And we hope you tune in again next week.